It's a move to save more lives in the most critical of times. Fort Bend County EMS will now carry whole blood on ambulances. Fort Bend County Chief of EMS, Dudley Waite, and Medical Director of EMS, Dr. Joseph Gill, are here with us this morning. Good morning to you both. Thank you so much for your time this morning. You know, this is a really important conversation to be having, especially in light of all these storms moving through the area, you know, wreaking havoc on so many of us. So talk to us, Dr. Gill, I want to start with you about what exactly whole blood is. What is it?
Yeah, that's a great question. Whole blood is exactly what's circulating through your body right now. It's not an individual component, rather it's the red blood cells, the plasma, and the platelets. The red blood cells carry oxygen, and the plasma and the platelets help form clots. So when you're bleeding to death, you don't need one component, you need the whole thing.
All of it.
Correct.
The entire component. Up until now, what was protocol? I guess this is a new move.
Yeah, definitely a new move. We're not the first, but it's definitely not common practice just yet. So in the past, we would give normal saline for trauma patients, which is essentially salt water. And so it provided little to no benefit and actually may have caused quite a bit of harm.
Oh, wow.
But now through the military studies, et cetera, it's gone into civilian use, and now we're seeing a rapid uptick in the States.
And that's what's amazing about science, right? It's
Right,
constantly evolving, and it's up to us to implement these new measures to save lives, to better lives. Give us a few examples of when, you know, whole blood would be needed out in the field on a trauma scene.
So we have protocols that drive what our paramedics do.
Yeah.
And so it's any patient, whether it's trauma or medical, that is in hypovolemic shock. So they've lost a tremendous amount of blood. Their body is reacting as the body will to try to survive. And then we will come in, and instead of doing that salt water that Dr. Gill was talking about, now we can give you a unit of whole blood, which your body can immediately start using to clot off the bleeding, to carry the oxygen throughout your body. And it really is a lot of times a game changer. A patient who is not looking really well will all of a sudden start responding again. They'll wake up some. I mean, it's really
amazing.
a game changer treatment.
That really is amazing. Do paramedics have to go through additional training with this new measure?
Yes, we've started IVs since the beginning of EMS over 50 years ago. What this is more about recognizing when it's needed, but then the logistical pieces. Whole blood is not salt water.
Yeah.
Whole blood is an organ that somebody has donated to save a life. And so we have to, it has to be stored very specifically, it has to be cared for very specifically. So most of our training has been on the logistics of caring for that unit of whole blood until we have the opportunity to administer it to a patient.
Talk to us, forgive me, I'm going off script. I'm just very curious about this. How do you know which type of blood to give to these patients if you're on a scene, you identify this patient is in need of whole blood? When does blood type come into play?
It doesn't for us because we use what's called low titer O positive whole blood, which is essentially a universal donor.
Okay.
So it doesn't matter what blood type you are, I can give it to you.
Okay. I know, too, you touched upon this, there were traces of this or studies of this being done in the military. Is that where this came from?
Yeah, that's where it came from originally, and then there's been some throughout, mainly in the state of Texas, to be honest with you. San Antonio, EST 48 and Katy, several agencies have started this.
Does this put any sort of current strain on our current blood supply?
So it could, but we are encouraging, and like San Antonio did when they started this area is working with Gulf Coast to be able to build a campaign for folks that when they find out they're O positive and they have low titer, we want them to come in and donate regularly. That helps the entire healthcare system, but will help us deliver this blood to a patient in the field, at their house or in their car after they've had an accident. People donating that O positive blood regularly will really help make this program be successful, not just in Fort Bend County, but across the entire Houston region.
Yeah, that campaign happens every day, but we're being extra intentional with it today as we have a blood drive happening right now in our parking lot and a few other locations throughout the metro area. Talk to us about, you know, encouraging people to get involved with donating.
So blood donation is critical, you know, and I will tell you as a paramedic for a long time, I'm like everybody else. I don't like needles,
Right.
but it's one poke. You give that unit of blood, and if it's whole blood, you're going to be able to help somebody in a critical time.
Yeah.
If they break it into components, you're going to be able to help 3+ people who are in a critical medical situation to be able to survive. You know, we always talk in our country about neighbors helping neighbors. There is no better way than giving the gift of life, as the blood centers love to talk about. It is something that, in my mind, it's a citizenship thing that we should all be practicing. It's a little scary, but you get that first poke underway, and then before you know it, you're done. You're getting some snacks, maybe a nice gift, and then 8 weeks later, you can come back and do it again.
Yeah, it really is remarkable, and knowing that more people within our communities are eligible to donate is also helpful. We so much appreciate you stopping by this morning.
Thank
Dudley
you.
and Dr. Gill, thank you so much for your time.